going to be about a 30 to 40 minute live is my goal. I want to share with you some information that was given to me last Friday, and that I have taken several days to go over, to research, to get additional information on, and go from there. So I will give it a second and wait for you guys to get in here, and then I will dig right in, and we'll go from there. Okay, so I'll give it just a second. I am looking for this link that I need as well, but I don't see it. I can't see your comments yet if you guys are commenting, but I'll just give it a second for you to get in here. Like I said, hey Melanie, how are you? Like I said, I do not intend for this to be an extensive live. I do want to give you the information that is that I have, so that you have it, and the public is aware. So before I go, hey Sabrina, hey everybody, that's my child calling. Let me decline. Sorry. Life has been a little crazy, as you guys know, for me and mine, and I just want to get this information out to you guys as quickly as possible. So let me minimize this so that I can be productive. Okay, there we go. All right, so that is done. Okay, so let me explain. Hey Melanie, hey Sabrina, hey everybody. Okay, so let me explain what has transpired. You all may have seen the press release that was put out late last week that Greg Neal, who has been the CEO of Bristol Regional Medical Center since 2013, had resigned, had stepped down from his position. Hey Marcia, hope that you and your mama are doing well, and Wayne, of course. Hey Tiffany. And it was a very brief article that says that he stepped down, and it just says, Greg Neal, CEO of Bristol, Tennessee Regional Medical Center, has stepped down. Ballad Health announced on August 20th, so 4 days ago. Mr. Neal has served as CEO of Bristol Regional since 2013 and was named president of Ballad Health's Northeast Market in 2018. Before leading Bristol Regional, he held roles at Kingsport, Tennessee-based Wellmont Health System, which merged with Johnson City-based Mountain States Health Alliance to form Ballad Health. And it says the quote from Ballad Health with regard to Greg Neal was, and I quote, "Greg is a strong and passionate leader who accomplished a great deal during his time at Bristol Regional Medical Center, and we are grateful for his years of service," Ballad Health said. That's the quote. Now, I want to start this broadcast off by setting a few things straight and clear. The purpose in me sharing this information is for public safety and awareness. It is for accountability for the medical monopoly that we have servicing this region. I feel that it is my responsibility to share this information, and it's important for people to be aware of things that have transpired, especially when you have zero other choices for your care. Having said that, let me say this. I have talked about this information with 2 other physicians, just to get a physician intake or outlook on this, a medical perspective on what happened, to just to make sure that I was, really grasping, the entirety of the events, and as with weighing all of that, I am choosing today to share the information. Now, let me say this. I personally have already reported this information to the appropriate organizations, or at least reached out to them to do that. So just the same way that that I felt about reporting on the cardiac deaths that we had earlier this year in March, is the way that I feel about reporting this information. Okay. So let me just go ahead and I'm going to give you the gist of the information that was provided to me. So, um, a physician, a cardiac physician, a cardiac surgeon by the name of Nathan Smith, who apparently has been family friends with Greg Neal for a while, according to these sources, um, had invited Greg to scrub in and observe this open heart surgery that took place last week. In the course of being in the operating room for this open heart surgery, multiple sources have now alleged that Greg Neal did not just observe this surgery. What is being alleged is that the CEO of Bristol Regional Medical Center, an administrator with zero medical training, actually held a scalpel in his hand and made an incision into a patient's chest for this open heart surgery. That is the information that has been provided to me and confirmed by multiple sources. So if we take a look at this information and why it would be astounding, which, by the way, I can't see comments. I don't know where they've gone, but I can't see your comments if there are comments happening. Oh, there they go. They just popped up again. So let me just, and I want to be really clear about this. So let me just say, what the information that I was given was that it was a member of the anesthesia team that was in the room that witnessed this event, and the member or members of the anesthesia team reported this information to management. My understanding is that risk management has spoken to all of the people that were in the OR. My understanding is that the privileges for that physician, for Nathan Smith, have been revoked at this time until the hospital. Wait, baby, what? You need to sit on my lap until the fellow surgeons on the board have decided what to do. Now, what I do not know is if Ballad Health has taken any other appropriate steps. Let me just say this, okay? Let me back up because there's a lot to digest about this. Okay, let me just back up. So, if in fact, okay, listen, Tutu's got to do this, okay? You gonna go sit with Dominic?
Dominic, come with me.
Okay, so no. Okay, well then you have to sit right here and be quiet. Okay, so it is not uncommon for administrators to observe a surgery. It would be uncommon to scrub in and actually yield a scalpel and make an incision into a patient when you are not, medically trained at all, right? Now, there are concerns. Let me just back up for a second. When medical students and people who are shadowing are in the rooms, like to even shadow in surgeries, like to get into medical school, you have to have so many hours shadowing. And what I came to learn that I did not know is that in order for you to even get into a shadowing program, typically you have to know a doctor or you have to know the family of a doctor in order to get in. ETSU, for example, has a program in Johnson City called Medical Horizons to help people who don't have that sort of, if you're not friends of doctors, how else do you get into medical school? Thank you, Kevin. That's my grandbaby. And so to me, it became even more astonishing that, this is a hospital administrator and this is a surgeon. No, I fixed it. Yeah, I fixed it. It's not broken anymore. So let me just back up, and I want to take this thing piece by piece, and I want to be very careful in saying that this is what, like you just saw in the comments, somebody else has heard the same information from a source that they trust. I have heard this information from 3 sources. And let me see it. And it's all been the same. So here are some questions around this. First of all, if in fact these things did occur, and Greg Neal took a scalpel and made an incision into the chest of a patient who was there for open heart surgery, did he in fact practice medicine without a license? I think that most reasonable people would believe that he did, right? Here, sissy. If in fact he practiced medicine without a license, that is a Class B misdemeanor. If the surgeon invited him to participate in that surgery and allowed him to yield that scalpel and make that incision, is he an accomplice? Right? That's the first thing. So you know me, I went and looked up some things. So here's what it says. The practice of medicine defined. And this is section is 63-6-204, and it says A1, any person shall be regarded as practicing medicine within the meaning of this chapter who treats or professes to diagnose, treat, operates on, or prescribes for any physical ailment or any physical injury to or deformity of another. And I think that you and I would agree that cutting, someone's chest open is would be considered a surgical procedure, right? That would qualify as operating on. So then I began to think about this, and if the scalpel is considered a weapon, right? If you open someone's chest with a knife or a scalpel, is that assault? If you're not a surgeon, are you assaulting that individual? Are you assaulting that individual? No, it's Nathan. Nathan Smith. Did I say Hill? I don't think I did. It's Nathan Smith. It's Nathan Smith. If I said Hill, I didn't mean to. It's Nathan Smith. So, well, Randy, I'm asking questions. So, I don't know that that's out of my league. I think that the average reasonable individual would be asking these questions. I said Smith. Thanks, Melinda. Yep, that's mine. So you put it in your bag. It's in your backpack. So you start to ask questions about how far. I don't know, because Raymond Bright, I do not know the name of the patient or any of that information. I do not know the patient. I don't know their outcome. I don't know if there were any negative outcomes. I don't know any of that information. Right? These are the things that have been alleged from multiple sources. And like I said, here's the thing. I think, okay, if you break this down, I think kudos to the people in the room who saw this and reported it to management, right? There was some staff in that room who felt like what happened was not appropriate, and they actually reported that information. So kudos to those individuals, right? I think that says something about the staff. Sometimes one of the things that I've said, that where I believe the root of a lot of the problems within Ballad Health comes from is from the administration. And I think that this is an example. So do you guys remember the first time I ever talked about Greg Neal? So what happened with Greg, the first time I ever talked about Greg Neal was, all the way back in last year in 2019. And there was that email that happened between Stan Hickson and Greg Neal and Monty McLaren, and they had talked about, they had agreed not to hire any CRNAs when Dr. Darling was making changes and moving some of their part-time CRNAs into full-time, and he was afraid that some of his people would leave him and go to Bristol or to Holston Valley because they hire CRNAs directly. And Greg Neal was like, no problem from Bristol's perspective. I don't have any vacancies anyway, right? Melanie Crane, that's my thing, right? That's the reason why. So if somebody comes to me and brings me this information and I get it confirmed with two other sources that this is what has transpired. This is what's being alleged that has transpired, right? Right. It's an allegation that the hospital CEO assisted in surgery by using scalpel to create an incision. And so what do I do with that information? Besides report it to the appropriate authorities, which I did, right, and the appropriate organizations, do I have an obligation to the public to share this information to make you aware of what has transpired so that you can be fully informed and be able to make choices about your care? Now, do I think that this is a problem with cardiology in Bristol? No, I don't. I do not think that this is something that the average cardiosurgeon or cardiothoracic surgeon would engage in. I just don't think that. From what I've been told is that, yes, Mary Johnson, yes. From what I've been told, this is a fairly new surgeon. That's what I was told. I don't really know the specifics. And so for me, like if it were just about wanting to share with you some juicy tidbit, I could have gone live Friday with this information. But when it's something this important and when it's something this severe, I take my time a little bit because I want to make sure that I talk to people that I know and people that I'm aware. Medical board of medical examiners, CMS, Joint Commission, Department of Health for licensure of healthcare facilities, all of that. And there will be people who will say, yeah, but that could hurt the hospital. And I do get that. What, baby? No, let Bubby help you up. You got to plug up. Ask Bubby to plug you up. It died. Okay, so right, Megan, that's the thing that I really want people to understand. She says the two surgeons she worked with there would never let that happen, and I would agree. Like, I have repeatedly said that I do not. She just wants you to plug it up for her. Okay, so just put it over there. Here, Dom, use this one. Come here, sissy. Give it to Tutu.
Wait, no, she can use that one.
I'll plug it up. Okay, so for me, and I apologize, but y'all know I'm on Tutu duty right now, so I have the babies. So here are some questions, right? Is it practicing medicine without a license? If it is, would a prosecutor consider it assault? So if Ballad Health had this individual resign, if they forced this individual to resign, right? This was the statement that they gave. Greg is a strong and passionate leader who accomplished a great deal during his time at Bristol Regional Medical Center, and we are grateful for his years of service. If in fact this did happen, and this is why he resigned, and this was Ballad Health's statement, are we to take this statement as a cover-up for what happened? And if so, does that make them in any way, shape, or form complicit?
Now we're putting these up here.
So, and here's the thing. This is not a skill. Hey, guys, don't fight.
We're not.
This is not a skill that he needed to know. This is not a patient that gave informed consent. And does the family know? Has the family been notified? It would, you know what I mean? Like, there are just lots and lots of questions around what has transpired. So let me just make sure that I give you all the points that I had written down. The only other question that I would have around this is, do the medical records indicate that that incision was made by him? And if not, did that physician, did that surgeon also falsify the medical records? You know what I mean? And file a false report for the surgery. Like I said, the background that I was given, Chrissy, is just that this surgeon is like, I don't know, fresh out of fellowship recently. Their families are friends, and invited him in to this open heart surgery. I am having difficulty even sharing the information, even after I have heard it from people that I trust. I'm having a really hard time even sharing it because it just seems so mind-boggling to me, right? It just seems very mind-boggling to me that this is something that would occur. So again, I want to be clear. This is what has been alleged. This is not something that I am saying definitively, yep, this is what happened. I'm saying this is what has been alleged because I was not in the room. And the fact, and I will also say this, someone else posted, when I posted the other day that I knew what happened last week, somebody else commented on that and said, yeah, we do too. And then somebody else made reference to Greg Neal, and somebody said he resigned. And then somebody else said that he resigned from the Bristol Chamber of Commerce as well. I do not know that to be true because he's still listed as chairman of the board of directors for the Chamber of Commerce. So I don't know that he's resigned from there. I do know that he has resigned from Bristol Regional. So that's it. That's really all I have for you. You can't get those, baby. They're not for you. Come here. Because it's not for you. So I can't see all of the comments like I missed Sabrina's. I just saw, see, Megan, I see yours replying back, but yeah, you want to play with them? And Dominic wants to play with them? Yeah. Okay, so I agree that she said that was enough. I know, and here's what's so crazy about this. I have 2 other stories regarding Ballad Health that are close, actually 3, but 2 that I'm this close to being able to broadcast on. And they are super significant as well. Yes, ma'am. No, you can't get them. You didn't ask Bubby if you could play with his toys. I agree that it is, if in fact these allegations are true. Yeah, okay, so let me just recap real quick. Okay, so the allegations are that the CEO of Bristol Regional Medical Center, Greg Neal, did not just randomly decide to step down last week and resign from his position. It is being alleged that he was forced to resign because last week he was, yes, ma'am. Last week he was he was invited to scrub in on on a open heart surgery and observe. And at some point during what was supposed to be this observation in the beginning, what is being alleged is that Greg Neal, the administrator, was allowed by this surgeon or invited by this surgeon to take the scalpel in his hand and make the incision into that patient's chest. The initiating incision is alleged to have been made by Greg Neal. That's the allegation. I want to say this emphatically. I do not believe that this represents the cardiology department or the cardiothoracic surgeons. I believe that this does represent Ballad Health's administration, especially in which the way in which they handle things. So, Megan, that's what I'm saying. I've been told that he was there maybe 3 or 4 weeks, this surgeon. That's what I was told, is that he's pretty new. That's what I was told. I am told that risk management met with everybody I believe it was Thursday of last week, and to answer questions about what happened, and that Nathan Smith's privileges have been revoked until the board of surgeons at the hospital decides his consequences from there. That's what I've been told. Yeah, see, it's the balloon. Oh, is that the balloon? That's balloon tea? Yeah. Have y'all ever had grandbabies that want you to have tea parties with balloons? Balloon tea. We're having balloon tea today. So again, as you all can see, I don't get any joy in telling you this. When I used to think telling people about things like this or similar things. Yes, Kevin Arnold. This is a prime example of the need for the hospital advisory board. Drink it? Okay. Oh, and eat my balloon? It was yummy. Thank you. It was yummy. As the teacup. You guys, I have advocated for this hospital advisory board to replace Ballad Health's board of directors because I don't believe that this hospital system has any real accountability. The things that I have seen, heard, and learned about, I sat and listened to a couple of stories today that I was like, holy crap. And so I think it's important, for people to understand, when I thought that these stories were going to make a difference to the state of Tennessee, there was more excitement in sharing the information, not because I was excited to like, ha ha ha, but because I was excited that there was something significant that would hopefully make a difference. Now, I don't even know what that is. I have no idea. I used to think that, it would be people dying, but people have died. So I don't know what will make a difference. What I do feel is a definitive responsibility to share information that I have been given by credible sources and report that information to the appropriate organizations so that they can investigate it. Now, if they investigate it and they say nothing bad happened, then so be it, right? What I do know is the last time I reported something that I heard that was significant, the letter that I got from the Department of Health said that Ballad Health had broken regulations and laws. So it is. You know what I mean? So that's all I have for you guys. I told you it was going to be a quick live, short, sweet, to the point. Again, these are allegations. Dani Cook was not in the room. I did hear them from multiple sources. Sources that I trust also heard it from people they trust. It's making its way around, and you know, just kind of is what it is. So we'll see what happens, and you know, and I'm hopeful that people will take the appropriate action. The reason why I posted the status that I did on Saturday, I think, when I said, "Hey, Ballad Health, I know about what happened at Bristol Regional," was to say to them, "Listen, I know what happened, so maybe you should. You see me? That you do the right thing. You know." Hopefully by now someone has talked to this family, whoever the family is, and acknowledged what happened, you know, because they deserve to know. Whether there's a negative outcome or not, they deserve to know. Yes, baby. Is that a window with flowers?
Yeah.
Yeah, you made me window with flowers?
Yeah.
Okay. All right. That is it. That's all I have for you all. I know that it's a lot.
What's a car?
That's what I believe. Hi, Izzy. And this is the thing. I'm going to say this one more time. I do not believe that this represents all of the cardiothoracic or cardiovascular surgeons. I do not think this is representative of the entire department. I do believe that this gives you a glimpse of the recklessness and godlike power trip that Ballad Health's administration believes that they have. I do believe that, because in what world, like, this is what I've seen from Greg Neal. I've seen him have conversations where he thinks it's okay to have, you know, antitrust conversations, you know, with Monty McLaren and Stan Hickson. So I've seen that. I now have heard these allegations, right? And it makes me think, if he's been the CEO of this hospital since 2013, what else has transpired there under his watch? What else has he done
What is that?
while he was there?
That.
What is that? That's my chakra stone. Where'd you get it? Did you take it out? Could you put it back for me?
But you want it.
But you want it?
Yeah.
You can play with it. So I know that this is a lot with my grandbabies and all of that, y'all. It just is what it is. I wanted to make sure that you were informed. And then we'll see what happens from here. Okay. Stay tuned. Like I said, I do have 2 other fairly large stories around Ballad Health that I'm working on, and that I'll be sharing with you soon. Just got a lot going on right now. So, my daughter saw Dr. Visconti today, which was, you know, he was great and thorough and all of that. But we have more testing coming and things like that. And, you know, my brother's here. You all know he had a vertebral stroke on August 1st. And he's not doing the best either. And he arrived yesterday. So we're just juggling a lot in my little world, you know. So I love you back, Christy. And I just felt like people ought to know. You know, I just felt like you ought to know, because, again, how is the administration handling it? Have they appropriately reported it outside of their organization, not just within their hospital, but are they reporting it to the appropriate boards and the appropriate organizations, or are they attempting to keep it as quiet as possible because it would be bad for them? Those things concern me. That's what concerns me, is how is this administration handling things? Okay, so that's all I have for you all. You guys be good, be kind, be safe, be all of that. And you know what I always say: be amazing, be light, and be love. Peace.